Hi, I'm Adam Saul-Jones. I'm the Exec Director of Improvement at NHS Improvement. It's been really great to spend the morning with improvers across London, particularly focused on patient flow.
It's been our pleasure to welcome colleagues from other trusts across London who are also engaged in service improvement work in patient flow here to UCLH today.
We know people work really hard, and to have a little bit of time out to come and share experience with colleagues has been very important.
This is a great event where people have been meeting their colleagues from other trusts who have tackled the same problems in different ways and have got a fresh perspective on how to make change happen.
The shared learning today has been fantastic, being able to meet with old colleagues that work at UCL as well as colleagues from King's and other trusts, and listening to what they're doing in their hospitals, which all sound fairly similar to what we've got going on in our hospital, but it's around actually looking at the detail of that and taking out the salient points of it and making sure that we all are learning just from those small points, because I think actually that's what makes a difference in the long run.
So we've had 50 people, about 12 different organisations who have come to talk about their journey, examples of good practice and how we can work together.
It was great to see examples of where people are trying new innovative things, achieving results, but also a real willingness to learn from each other.
This morning we shared the exemplar ward programme and our working improvement team to deliver a quality improvement programme to support the ward's improvement journeys. It's been really great to share with our London colleagues the work we've done, hear their challenges and their thoughts on how we can do things differently.
I think it's been really interesting to see how many different organisations in London are carrying out a very similar piece of work, and it's actually good to see where we differ slightly and also where we can find some similarities. If I could take one thing away from today, I would say that we have a great opportunity to learn from our colleagues in other London trusts, and I would like to think that these sessions in the future will be massively helpful, and that we can take some key learning points away.
2 or 3 of the themes that came out very strongly were around the need to engage everyone in this work. It's really easy to operate in silos, but the importance of engaging both patients as well as clinical staff and operational staff in this is really important, but also the crucial importance of data and understanding the impacts that the work we're doing has, in order to both communicate it to other people, but to be able to use it as a management tool to help operationally manage complex systems and to allow patients to flow through those systems as best possible.
The thing I found most compelling is people have really been willing to change the way that they work and to actually change their services in a way that has really driven patient improvement.
It was really great to share with London colleagues similar programmes that they've run and the challenges they've faced and suggestions for improvements and changes. And it was great to hear how people appreciated the work we've done and see how far we've come.
I think we've had a great level of engagement and enthusiasm for working together as a service improvement community, and I'm hoping that we can take this on now to look at all aspects of improving hospital care.
I think there's a lot of improvement we have already done, and it's brought it into sharp perspective as we look at other trusts. But I think there's still a lot more that we can do, and hopefully today is a good opportunity to reinvigorate the process.
Today's been a fantastic opportunity to bring people together, and it's just exciting that 50 odd people felt the need to turn up today because they could see some connections and some opportunities to share and learn from each other. So I'm hoping, I can certainly feel a bit of energy in the room, I'm hoping that will translate into something going forward that we can really start to galvanise, and NHSI can support people to take that forward across London.